Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Breast lump and its evaluation. So the first step of breast lump evaluation is to categorize them. So in terms, the breast lump is going to be in age group less than 40 years. So if it is less than 40 years in terms of a pregnant or a lactating woman, so in terms of the pregnant or the lactating woman, so first thing you do is you check for the USG. And in terms, the USG turns out to be, let's first look it as abnormal. So in terms it is abnormal, there is two possibilities. One is in terms it is the presence of a cyst. So in terms it is the presence of a cyst, we need to aspirate them. So the cyst needs to be aspirated. So the other abnormality is, one will be the presence of a cyst, and second one, it can be a presence of a solid mass. So in terms of the presence of a solid mass, you do a USG guided needle biopsy. So there's a USG guided needle biopsy which is done. So there's a USG guided needle biopsy which is performed. And upon performing the USG guided needle biopsy, and if it is still uncertain, so if it is still uncertain, so what is done? If there is uncertainty on the USG guided needle biopsy, there is a excisional biopsy is done. So the excisional biopsy is done, and excisional biopsy is again, it is divided into two. So in term it is found to be benign. If it is benign, you reassure, discharge and follow up. So you reassure, you discharge and then you follow up. So in terms it is malignant, what do you do? So in terms, if it turns out to be malignant, you do the treatment accordingly. So you do the treatment accordingly. Now we saw this was all about age group less than 40 years, that is pregnant or lactating. Now let's move on to the age group greater than 40 years. So in terms of age group greater than 40 years, we perform the mammograph. So what we do is the mammogram. So the mammogram is done along with the presence of the USG. So again, the same cycle continues. So when we do the mammogram with the USG, in terms it is abnormal. We'll just quickly recap this. If it turns out to be abnormal, then we perform the cyst. And cyst, if it is cyst, you aspirate. Next, when you look at the solid mass, there is always a USG guided needle biopsy which is done. So USG guided biopsy, that is needle biopsy is done. And in case it is uncertain, if it is uncertain, what is done? There is a excisional biopsy which is performed. So if it is a excisional biopsy which is performed. So if the excisional biopsy is performed, it can be either benign or malignant. If it is benign, you do reassure, you discharge, as well as you follow up. And in terms it turns out to be malignant, you treat it accordingly. So this was in terms of a totally abnormal finding. Now let's look at in terms of it is a normal finding. So in terms of it is a normal finding, you look for a clinical suspicion and then you look for a needle. So you look for a needle as well as a excisional biopsy. This is done. So when you do this, you look for a benign and malignant. Again, it comes to the same map, that is, in terms of benign, you do a reassurance, you do discharge as well as follow up. In terms it is malignant, you treat it accordingly. To learn and grow daily like this, please do subscribe.